This is how type 2 diabetes is affecting people of low socioeconomic statuses. For a little bit of background, type 2 diabetes is affecting over 422 million people worldwide, and it's growing due to urbanization and poor lifestyle choices and diets. The lower economic groups are particularly on the rise in type 2 diabetes because they are limited to access to healthy foods, healthcare, and higher stress levels. And these factors contribute to a delayed diagnosis, and which leads to more severe complications like heart disease and kidney failure, especially in those low income areas. And then, so the problem with this is that it affects people of lower income socioeconomic status, and it's present at the global level. And this is especially noticeable in areas that are large differences in socioeconomic statuses. And this is a public health issue for three main reasons. One, the economic impact. Managing diabetes and its complications already puts a financial strain on healthcare systems, but particularly in low-income communities when there's not enough resources to do so. And then health inequalities, because differences in outcomes among those groups highlight the inequities in healthcare access and quality, which is an issue that a lot of health professionals are trying to solve. And then on a global scope, the increasing prevalence of type 2 diabetes in low and middle income countries is an obstacle in achieving that global health equity.
I'm Brendan Hogan, and this is a literature review. So, in a study conducted in 2011, researchers found strong evidence that getting type 2 diabetes was associated with being of low socioeconomic status. That was in high income countries. The results were inconclusive for medium to low um, income countries. But then more recently in 2019, another research group, they went out and they compiled all of these different studies, and they went through their conclusions, and they found that most described a clear relationship between socioeconomic status and diabetes complications. And then this chart up here shows the different classes of socioeconomic status with their respective the inpatient visits of each of them, which were related to diabetes. So you can see how in the different classes, there's more in the lower classes of socioeconomic status with the diabetes. And then here's some of the global statistics. The one that I found was from the National Health Interview Survey, and that was from 2011 to 2014. And in this, we can see that the prevalence of diabetes increases on a gradient from highest to lowest income, which means that people of higher income will have lower rated diabetes, and people of lower income will have the higher rated diabetes. And this is also showed people who are considered poor had a 100.4% increased chance to get diabetes when compared to people of high income. Um, and you can also see this in the graph, which shows you the level of the socioeconomic status in the neighborhoods and then the amount of or the percentage of people with diabetes. And then these studies give us solid foundations to base our claims on and allow public health officials to start implementing solutions to lower the prevalence of diabetes in areas of low socioeconomic status.
Ongoing efforts. These are some of the things that are currently active to help those suffering from or on the verge of type 2 diabetes at multiple levels in the world. Locally, there are community health programs which help provide free health screenings and education, food assistance programs that work with food banks to get people of low socioeconomic status healthier and more nutritious food, and also school-based programs that school districts implement with physical exercise and nutritional education during the day. At the national level, the CDC's National Diabetes Prevention Program, which promotes lifestyle changes to prevent diabetes, the Affordable Care Act, pushing for more coverage of diabetes treatment and prevention through Medicaid, and lastly, capping the outrageous price on insulin. At the global level, the World Diabetes Foundation and also the International Diabetes Federation both provide affordable treatments and education for these people of low socioeconomic status. Gaps and insights. Some things that have been proven to work are a lot of the community-based programs as they help tackle both prevention and treatment at the same time. Also, partnership between public and private sectors, uniting the two to be able to better reach the people of low socioeconomic status. Some areas for improvement are the limited access to healthcare in these mainly rural areas, lowering the high cost of medication, such as insulin, and also inadequate infrastructure, such as clinics, but also gyms, parks, and places where people can physically exercise and help prevent or manage type 2 diabetes.
Okay, public health approach. Type 2 diabetes disproportionately affects lower income populations, as stated before. To combat this issue, we propose a new public health approach that will reduce the prevalence of type 2 diabetes in low-income populations by increasing access to physical activity for low-income individuals. By combating one factor contributing to type 2 diabetes with an accessible and achievable program, the rate of type 2 diabetes can be lowered in these populations. So, our goal of our health approach. So, the program's goal will be to reduce the rates of type 2 diabetes among low income individuals by implementing different events and activities to increase access to physical exercise in low income individuals. Events and activities include establish free exercise classes in public spaces such as parks with volunteer fitness instructors, work with local gyms to create discounted memberships for low income individuals, and partner with schools to create after-school fitness classes for children. These programs will be successfully achieved through state funding and local community engagement and volunteering. Measures of success will be determined through participation in type 2 diabetes prevalence in the low-income communities this program would be implemented into.
I'm McKenna McLean, and I'm doing the summary for this presentation. As you can see, that people in low socioeconomic statuses and areas are affected greatly by diabetes, more so than those who are not in these areas. And there are many ways in which public health practices could help these issues. As we can see, these problems are rooted in the environmental and infrastructure problems in these low economic areas, and that directly impacts healthcare access, education, food sources, supply and nutrition goals, and so much more. Working together as a community with state, local, and global governments and programs and implementing those can help better these issues. As public health professionals, there are many ways in which we can better these issues because it's a direct public health issue, because it affects the general well-being and health of the public. Incorporating more community-based resources and programs, such as working with schools to implement more physical education programs or nutrition, or churches or anything in the community, and implementing more local programs and government programs for funding as needed would help to ensure that this issue can be lessened and potentially even resolved in these areas. And here's our works cited.